With healthcare workers now evacuated from Kashechewan, Indigenous Services Canada says it's working with community leadership to make arrangements for members who do not wish to leave. CTV's Lydia Chubak has the latest.
In cases of a full evacuation of a community, officials with Indigenous Services Canada says it's policy that the nurses are usually on the last plane out of the community, and they say nurses left a couple of days ago.
So the chief met with community members well in advance of the nurses preparing to leave and ensures that everyone is aware of the situation and they make decisions for themselves if they choose to stay in community.
Despite the current water crisis in Kashechewan, not every community member has chosen to leave.
We worked with WAHA, the Winnebago Area Health Authority, Orange, which is emergency land-based emergency response, and community and Ministry of Health to ensure that services are in place for community members who choose to remain in Kashechewan.
We're starting to make plans to get as much people out as possible. A lot of people that are currently in the community are deciding to stay. However, we're trying to develop some plans to allow them to be there, such as our community across the river, Fort Albany. So we're trying to see how they can access healthcare.
Westaway says it remains the chief's decision when community members can return, and she says it's difficult to suggest a timeline as engineers are still completing their assessment of the water system. Lydia Chubak, CTV News, Timmins.